Welcome, everyone. If you love digging into complex medical breakthroughs and seeing them broken down into clear, structured takeaways, well, you are in the exact right place. Today we're unpacking a truly fascinating presentation by Dr. Masafumi Ikeda. We're going to explore the cutting-edge evolution of liver cancer treatment, specifically hepatocellular carcinoma, which actually makes up about 90% of all liver cancer cases. We're taking Dr. Ikeda's deep clinical insights and turning them into an explainer that is going to completely reshape how you view modern oncology.
Okay, let's dive into this, because this single number right here represents an absolute revolution in medicine. Just over a decade ago, if a patient had advanced liver cancer, doctors essentially had one targeted drug in their toolkit. Just one. Today, there are 8 distinct systemic drug options available. I mean, this isn't just a minor little update. It's a massive paradigm shift. It completely flips the narrative for patients from one of fear and limited options to one of genuine, individualized hope.
So here's our quick roadmap for today's explainer. 1. Changing face of liver cancer. 2. The complex treatment puzzle. 3. The drug therapy revolution. 4. Shrinking tumors for surgery. And 5. The future of treatment.
Let's start with Section 1. Changing face of liver cancer.
The very profile of who gets liver cancer is rapidly evolving. Just look at this statistic from Japan, which actually has some of the highest liver cancer rates and most advanced tracking in the world. An astonishing 57% of their liver cancer patients are now over the age of 75. So we're dealing with a heavily aging patient population. This means doctors aren't just fighting a tumor, they're managing cancer in patients who might have a whole host of other age-related health complexities. Age and general bodily endurance have become a massive factor in how modern treatment plans are designed today.
And the underlying causes are shifting just as dramatically. We used to associate liver cancer almost entirely with viral infections, but that's just not the full story anymore. That slice representing hepatitis C is shrinking beautifully, mostly thanks to incredible advancements in antiviral treatments and safer blood transfusions. But look at the non-B, non-C slice. That category is growing rapidly. It represents liver cancer driven by metabolic and lifestyle factors, like fatty liver disease. So we're successfully beating the viruses, but metabolic health? That is quickly becoming the new battleground.
Moving on to Section 2, the complex treatment puzzle.
This introduces the core problem doctors face, because liver cancer isn't just about the tumor, it's about the organ itself. Think of it kind of like a dual-factor engine. With most cancers, the treatment is largely dictated by the cancer stage, how big the tumor is, how many there are, if it's spread. But with liver cancer, that is literally only half the equation. Doctors have to constantly balance the severity of the cancer against the underlying strength of the patient's liver function. If a patient's liver is failing, which doctors measure using clinical systems like the Child-Pugh classification or ALBI scores, a highly aggressive cancer treatment might actually do way more harm than good. So it's this incredibly delicate, high-stakes balancing act of fighting the disease while protecting this vital, life-sustaining organ.
Let's see how this all builds into an actual treatment algorithm. Historically, the path looked a lot like these 4 steps. In the early stage, if the liver is strong, doctors remove the tumor with surgery, or they basically burn it away with radiofrequency ablation, or RFA. In the intermediate stage, where there are multiple tumors, they use a procedure called TACE to block the blood vessels feeding the cancer. Then, in the advanced stage, where cancer has spread or invaded blood vessels, they rely on systemic drug therapy. And finally, the end stage focuses on palliative care. But as we're about to see, the boundaries between these steps, they are starting to blur in the absolute best ways possible.
Which brings us to Section 3, the drug therapy revolution.
Now, what's really interesting about this timeline is the massive, rapid explosion of new treatments. For almost a decade after 2009, sorafenib was the only frontline drug. The timeline was completely stagnant. And then, suddenly the dam breaks. In 2018, we get Lenvatinib. In 2020, we see the approval of a super powerful combination, Atezolizumab+Bevacizumab, which blends immune therapy with tumor blood vessel starvation. By 2022, another dual immunotherapy combo hits the market, durvalumab and tremelimumab. We literally went from a single tool to this incredible array of targeted combinations that are significantly extending patient survival rates.
But of course, this revolution requires careful navigation. Take a look at this data from the recent CheckMate 9DW clinical trial, which tested an unapproved combination of ipilimumab and nivolumab. The efficacy is staggering, a 36% response rate, meaning tumors shrank significantly in over a third of patients. But we have to look at the risk column too.
Because these drugs supercharge the immune system, 30% of patients experience severe immune-related side effects, requiring high-dose steroids, and there was a 4% mortality rate tied to the treatment itself. It's a profound reminder that while these new tools offer incredible survival benefits, they have to be weighed incredibly carefully against the risks by both the doctor and the patient.
Let's move into Section 4, Shrinking Tumors for Surgery.
This is where we see how these new drugs are bridging the gap to a potential cure. For decades, the most terrifying thing a liver cancer patient could hear was that their tumor had grown too large or invaded too deeply to be surgically removed. It basically meant a definitive cure was off the table. But what if we could turn back the clock on the tumor's growth?
Enter a concept that is literally rewriting the rulebook, ABC conversion. This is the process of taking those advanced systemic drug therapies we were just talking about and using them aggressively up front. The goal here is to shrink initially inoperable, highly advanced tumors down to a manageable size so that a surgeon can finally go in and safely remove them. It's taking patients from the advanced column and physically moving them backward into the early curable column.
And the numbers backing this up are just breathtaking. In a Japanese trial combining the systemic drug Lenvatinib with a localized TCE procedure, doctors saw a 79% response rate. Nearly 8 out of 10 patients saw their tumors shrink. I mean, this level of tumor reduction using drug therapy in liver cancer was practically unheard of just a few years ago.
And this brilliantly illustrates the ultimate outcome of that shrinkage. In a specific study focusing on patients whose tumors were initially deemed entirely inoperable, meaning the cancer had already spread to blood vessels or outside the liver, 67.5% of them were successfully converted to a surgical option after powerful drug therapy. Almost 7 out of 10 patients were given a pathway back to a potential cure. That is what medical progress looks like in real time.
Finally, let's look ahead with Section 5, the future of treatment.
Researchers are now pushing these therapies earlier and earlier into the patient journey to prevent recurrence. We're seeing trials for adjuvant therapy, which uses these powerful immune drugs immediately after a successful surgery to hunt down microscopic cancer cells. We're seeing intense focus on borderline resectable cases, using localized chemotherapy before surgery to ensure cleaner margins. And fascinatingly, trials are even exploring TT fields, literally using specialized external electric fields to disrupt the cancer cell's ability to divide. The innovation is coming from absolutely every angle, proving that the medical toolkit just keeps expanding.
So, as we've seen today, liver cancer is no longer a single narrative of inevitability. It's a complex, evolving landscape where an aging population meets an unprecedented boom in medical technology. Doctors aren't just reacting anymore. They're actively shrinking tumors, combining therapies, and rewriting patient outcomes entirely. As liver cancer treatment shifts from a grim, one-size-fits-all approach to a highly personalized, dynamic toolkit, the very concept of hope has changed. Whether for you, a loved one, or simply your understanding of modern medicine, I want to leave you with this. As treatments become more individualized than ever before, what could your unique path to hope look like today? Thank you so much for joining me on this explainer. Stay curious, keep learning, and I'll see you in the next one.